Hi, I'm Brad Ramsay. I suffered cardiac arrest here at Woodlands Camp. I had been playing basketball, 3-on-3 basketball with a bunch of high school 14, 15-year-olds. That's why we're here in the gym. And I don't know if we won or not, but I do know that I made an impression.
I was here the day of the event, and really the stars of the show were the medical staff from North Point and White County EMS. Where our team played a part is we were ready in advance to be able to provide support. So their leadership called our guest services team, said that there had been a cardiac arrest. Our team knew where the AED was. It was charged up, ready to go. They were able to get it up here quickly and provide defibrillation.
I had heard that he was going to Northeast Georgia in Gainesville, which I'm very familiar with working in EMS. I know it's a great hospital. There's lots of very capable doctors there. I know they're great in the cardiac unit there as well. So I knew he had a pretty great prognosis. From the time that he lost pulses, someone was there to feel that pulse go. We started immediate compressions. He was defibrillated early and 3 different times, and he was breathing by the time we got him out of the gym. White County EMS, I've heard, has great protocols, so I knew he was in great care, and then I knew he was going to the best hospital for his situation.
When I saw the ambulance, obviously I knew something was very wrong. I was able to see him in the back of the ambulance. He was unconscious. They took him with lights and sirens, and I followed behind. Somebody drove me to the hospital. I went into the emergency room. I had somebody come and escort me to the waiting room where Dr. Patel was doing a procedure. So that felt like hours. I'm sure it wasn't. The next time I saw Brad, it was in the room where he was in slight recovery.
When he was brought to our hospital, we directly took him to cath lab. That's where we do the heart procedures. And there we found that he had multiple blockages. In addition, also he was in cardiogenic shock. Now the cardiogenic shock is a condition in which your heart is not able to pump blood around the body. So the body is not getting enough blood, and eventually you can have a fatal outcomes like fatal injury to the organs or even death. So at that time, we decided, we assessed the situation and go for the balloon pump insertion to help his body and the heart. Something that in our language we call it intra-aortic balloon pump. And that helped him to support and transient him to give a transient care until he got the bypass surgery in a few days.
I was taken up to Brad's intensive care room where he had been intubated. He was unconscious at the time. They were able to wake him. Several days later was when the surgery happened. The day before the surgery, Dr. Hastings came and told me he was in good hands. He had done over 6,000 of these procedures and that everything looked very promising and there was no reason not to expect a full recovery.
So we first met Mr. Ramsay after his cardiac cath, which revealed severe 3-vessel coronary disease and a sustained decrease of ventricular function. So they put an intra-aortic balloon pump in to assist his heart and basically let his heart recover from the prolonged CPR, as well as I think he got shocked a couple of times. So whenever that happens, the heart's stunned, and the intra-aortic balloon pump allows the heart some time to recover. It also allowed us to ultimately get him off the ventilator and find out neurologically that he was still intact, and he was intact because some people did some really good CPR in the field. And I understand that at the time of his arrest, someone recognized quickly he didn't have a pulse, started CPR, and someone ran and got an AED. They didn't have one where they were, but they knew where they could get one. And so due to the good bystander CPR, they were able to keep his brain alive and then also shock him back into a rhythm that allowed him to get to the hospital.
So yes, I remember from the Thursday, 2 days after the surgery, when I came to. The care, the nursing care, very, very attentive. I mean, I was hooked up to more machines and more intravenous, and I care to remember the tubes and all that was quite overwhelming. And so very attentive nurse. A lot of the physician who had attended to me in emergency came in and introduced himself. the physician, the cardiologist, the cardiosurgeon who had attended to me came in as well. So very, very attentive, not only in terms of the care in the hospital, but the discussion around post-hospital, cardio rehab, and all the elements that it would take to sort of return to normal health. So
the role of the first responders at the scene to start CPR immediately was key in saving his life. There are times that you can shock people back into a rhythm if they've been without CPR. They can have a lot of brain damage and such. So they did great CPR. I think he arrested a second time in the ambulance on the way in, and EMS shocked him back into a rhythm. And once they got him safely here, he stabilized, had to be intubated, and was in critical care. They cathed him right away. But he was allowed the opportunity to recover because of all the great work that was done in the field, as well as in the ambulance on the way in, recognizing what was going on and getting him here quickly as possible.
For those that participated in not just Brad's resuscitation, but the surgery, the aftercare, thank you. I remember saying to Dr. Hastings, thank you for when you decided to become a doctor, because that decision decades earlier was instrumental in Brad's recovery. So thank you to all that participated in his healing.